In this video, we will discuss the principles and fundamentals of pediatric practice. This will review why and how occupational therapists work with children and their families to promote their engagement in their occupations. Let's get functional. OT starts with the referral due to a specific diagnosis, such as autism, or a functional problem, such as poor fine motor skills or oversensitivity to classroom stimuli. Notice this stems from a bottom-up approach. However, the OT should always take a top-down approach and consider the child holistically. The key is client-centered interventions. We first identify the concerns and priorities of both the child and family. It's based on identifying their interests, difficulty, and preferences. How occupational therapists improve a child's performance and function is threefold: providing interventions to enhance performance, adapting activities and modifying the environment, and consulting and educating and advocating for the child. Keep in mind the best practices in pediatric occupation, which include child and family-centered practice, a comprehensive evaluation with the appropriate assessment tools, and effective interventions that are appropriate for the child. The OTPF considers context to be important in the OT process. Remember to consider the child's physical, social, and cultural factors. The overall goal is function in a safe environment to promote function, exploration, play, learning, and social interaction. Additional themes that are important to consider include inclusion with peers and family, most natural environment if possible, cultural awareness and family values, and more specifically, an occupational therapist should consider the family composition and hierarchy, the decision makers, who they are, level of expected independence, feeding and sleeping practices, discipline, how much help the family expects to seek, communication styles, and how disability is perceived. Given the opportunity to provide family-centered intervention is much better than child-focused models. Last, to tie it all together, OTs should use evidence-based practice combined with their professional reasoning. Starting in the beginning of the process, we have evaluation. Comprehensive evaluation of the child involves developing an occupational profile, which includes interview and observation to find out the child's functional strengths and limitations. Also, it includes assessment and analysis of performance by looking at developmental performance and functional behaviors using standardized evaluations, structured observation, and focused interviews. It's also important to consider the environment, especially evaluation through multiple environments. Do you remember the child's most important occupation? Yep, play. So why do OTs play with children during their interventions? Well, it serves to assess, analyze, and promote engagement through performance of play. By engaging in play, the child can use this occupation to organize time, space, materials, patterns, habits, and roles. It's a therapeutic medium because, well, play is fun. Some examples are cause and effect relationships, exploring objects and understanding rules, taking turns, that kind of thing. Let's talk about how occupational therapists should design their interventions. Optimize the child's engagement. Keyword here is active, not passive. Provide a just right challenge. Establish a therapeutic relationship, including with caregivers. And last, interventions should be graded to have the appropriate intensity for proper reinforcement. OTs should also use and implement assistive technology where appropriate. Similar to concepts of how the PEO model looks at the environment, children with disabilities may often benefit from modifications to the environment. The most important is the child's safety and comfort. Also, increasing accessibility through modifications and accommodations. Keep in mind that environmental modifications may affect everyone in that space. This is because the role of the OT in school setting is to help the child succeed in school. So in closing, it may feel overwhelming the amount of assessment tools, interventions, theories, assistive technology, toys, and tools that can be used in pediatric occupational therapy practice. You can always fall back on the fundamentals that we discussed earlier to guide your decision making and practice. These include taking a top-down approach, being family-centered, considering the child, their family, culture across environments with safety in mind. Thanks for listening, and I'll see you in the next one.